Hi, my name is Ali Scott and this is my video on clinical and communication skills. The purpose of this video is to show you that I can successfully complete specific clinical skills whilst demonstrating appropriate and effective verbal and non-verbal communication techniques. The clinical skills that I will be performing are palpating a radial pulse, obtaining a respiratory rate from the patient, doing an auscultative and palpative blood pressure, undertaking a chest auscultation and obtaining a Glasgow Coma Scale score. I've got my standard precautions of gloves and goggles. Hi Mr. Jones, is it okay if I take your pulse?
Sure.
And you're in a comfortable position?
Yep.
Can you just relax your arm for me? Have you ever had your pulse taken before?
Yep.
And do you know what the value you got when that was taken?
Around about 60.
60, and was that a regular one for you?
Yes.
Yep, okay. And so I'm going to get 2 fingers and put some pressure over the radial artery until I feel palpations, which I can. It's about in line with the thumb, and as they feel regular, I'm going to time it for 30 seconds. So I got 31 beats, so I times that by 2, and that's 62 beats per minute. Proxemics, so the use of space, time, I got with eye level with the patient and eye contact. My standard precautions of gloves and goggles. Hi Mr. Jones, is it okay if I take your respiratory rate?
Sure.
Have you had this taken before?
No.
Do you have any history of asthma or anything like that?
No.
No? And do you have any history of other respiratory problems?
No.
Like pneumonia or anything?
Well, I did have pneumonia a couple of times.
Yeah, okay. So I'm just going to look at Mr. Jones's chest and watch it rise and fall for 30 seconds. Okay, so I got 7, so I times that by 10, that's 14, which is quite normal, which is great.
Good.
And are you anxious or concerned about anything that would increase your respiratory
No.
rate at all? I use time, I use proxemics or appropriate distance, haptics, which is touch and eye contact. Standard precautions of gloves and goggles. Now Mr. Jones, is it okay if I take your blood pressure?
Yep.
Have you had this taken before?
Yes.
And was there anything irregular about that?
No problems.
And you had no discomfort?
No, just a bit of
So
pressure.
just pressure?
Yeah.
And you don't know that you have high or low blood pressure or anything like that?
I'm pretty sure it's just normal.
Yeah, no problem. So what I'm going to do is that's an inch above the elbow crease that I did, and I'm going to put 2 fingers over the radial artery to feel for the radial pulse, and I can feel the palpations. And what I'm going to do is pump the blood pressure cuff up about at 10 per second to about 150 until I can no longer feel the pulse. And that's happened, and then I will slowly release it by the valve at about 5 per second. And I can start to feel it again, and that was at 122, so then I will just release this to relieve the pressure. And now what I'm going to do is a auscultative blood pressure. So what I'm going to do is feel for the brachial, just put your arm out straight, the brachial artery, which is there. I'm going to put the diaphragm of the stethoscope between the elbow crease and the blood pressure cuff. And I shouldn't hear any noises. And I'll pump this back up at 10 per second, about 30 over what I got as a systolic pressure from the palpative blood pressure. So this will be at about 150. Okay, so I'm going to start to release this at 5 per second. And when I start to hear the pulse, and that's at 122, which is the systolic. So I can hear that in the stethoscope, and then when I can no longer hear it, that's the diastolic. So that was at 72, which means your blood pressure is 122 over 72, which is very good for someone who's 70, which is great. Eye contact, same level as the patient. I use proxemic, so appropriate distance and the use of time. I've got my standard precautions of gloves and goggles. Hi, Mr. Jones. Is it okay if I listen to your chest?
Yep.
Yep, that's fine. Have you had this happen before?
Yep.
Yep, so just lean forward, put your hands outstretched. And have you had any problems with this?
Nope.
So you don't, no crackles or anything? Do you
Nope.
suffer from asthma?
Yep.
Is that since you were a baby?
Yes.
So can you just open your mouth slightly and give me some coughs? I'm going to put the stethoscope in my ears. Can you take some deep breath through your mouth, please? Is it okay if I lift your shirt as well? Yep. So I put the diaphragm on the stethoscope and I'm listening to the area for 2 breaths. I'm listening to the apices, which is the top area of the posterior chest of Mr. Jones. And the left sounds equal the right sounds, which is great, which means he has equal breath sounds, and they're quite regular. And I can't hear any crackles. And I'm in the mid zone now. And now I'm going down to the basal zone. Just to make sure that the lungs, the air is going down all the way to the base of the lungs. That's great. Thank you, Mr. Jones. Use haptics, which is touch, proxemics of space, eye contact, and appropriate body gestures. So I've got my standard precautions of gloves and goggles. Now, Mr. Jones, how are you feeling today?
Good.
So because you just tracked me with your eyes then, I could tell that you had spontaneous eye movement, which is a score of 4 in the eye section. Now, can you grab onto my fingers, squeeze tight, and let go? So you're obeying my commands, so that's a score of 6 in the motor part, which is of the Glasgow Coma scale. And can you tell me your full name?
Nicholas Jones.
Yes, and what day is it today?
Monday.
And the month?
May.
Yes, that's correct. So because he said that all correctly, that shows that he's aware of his surroundings and he's orientated. So you get a score of 5. So altogether his score is 15 in the Glasgow Coma scale. Eye contact, being level with the patient, the use of time, and I also use body gestures such as smiling.